Hi everybody, this is Jim Coley's video. Yes, you're looking at a white screen. Let me introduce you first to the client. This young man's name is David. Now, as you probably should expect, I have received permission to use these names. I've received permission to tell this story and present this information. So David is a fourth grader. He goes to school at the Berryville School District, and he's a pretty happy kid. He likes to do lots of things, and David has got disruptive disorder conduct and struggles with getting along with other people at times. He struggles with trying to see other people's points of view and can get quite a little bit mouthy sometimes and a little bit disruptive to his family. He struggles the most with his sibling, his little sister Samantha. Now Samantha is a pretty good girl. They're both pretty good kids. But they have got a world going on around them that has so many things going on that it's pretty sad. These two kids are both clients, and that's why I wanted to kind of do it in this fashion. There's a lot of players with this dynamic, and I think it'll help to have some faces with names. The other day, Samantha was in session with the therapist. Samantha's the one who brought this whole story up. So let's back up a little bit and get some players in here. You know David already and Samantha. Let's put bio mom and bio dad. This used to be a happy family until, you can probably guess it, something happened and there was a divorce. Mom split up from dad. Mom went her way. They were single for a short time and have both remarried at this time. So dad is remarried to stepmom, and mom is remarried to stepdad. Now, unfortunately, you'll have to excuse stepdad's face right now, but this will come into play real quick. So these two families try to do a blended situation. They stay 1 week with dad, and then 1 week with mom. Regardless of how you think about this situation, I've got my premise already, but it's a very difficult situation because whose rules are we following? This week, are we at mom's? Are we at dad's? Whose rules? And it becomes a lot of difficulty with this situation. Ironically, with this situation, though, the kids at school are fine. The teachers report good grades. The teachers report good behavior. They don't go to the principals. They don't get ISS, they don't get suspended. So most of the problems, all the problems that we experience are with the kids at home. So when we do collaterals with the parents or with the teachers, we get great reports. So here's the story real quick. Part of the problem is when mom goes to work. When mom goes to work, the kids are left with, guess who? Stepdad. The difficulty there, when mom and stepmom is away, it's been reported that stepdad has been known to push David, make fun of him, and most recently has even said, I don't really care if any of your family on the other side is alive or not. All this information was brought to light by the little sister. Mom is going to be approached shortly as the therapist becomes involved in this, so this case is very recent. So what kind of cultural considerations do we have? First off, we have lots of misunderstandings. We're not sure exactly the scope of it. We're not sure of the magnitude of it. But we do know that when we talked to David, David said this is happening. He did confirm what his sister said was true, and he's struggling with it. There's a lot of misunderstandings due to lack of information. Well, right now, all we have is the story of the kids. Dad, bio dad, and stepmom are very concerned as mom is going to be brought in and visited with to see what is going on. Some of the theories that are used with this, in my understanding, is systems theories. There are so many different systems going on. We've got the stepdad, the step parents. We've got difficulties with transportation back and forth between 1 week on with parents, another week with the other parent. There's also some conflict theory going on. Very, very strained situation. One thing that makes it even more difficult is bio dad and bio mom do not get along at all. They keep themselves separated in distance and speak only when they have to. Very difficult situation. So how do we deal with this in an ethical manner? First off, we've got a conflict of interest. We've got the client, the kids. Both of these are our clients. And we want to be true to them. We've built great relationships with them. These kids have been in the system, in the program, for several years through the divorce, and we want to make sure that we maintain the respect of these clients. We've also got a commitment to them. We're invested in these kids. And then they, because they've been in the program long enough, I believe have the right to self-determine some of their outcome in their future. Where do they want it to go? What do they want to see happen? From the client's perspective, the client's sister told the therapist, and she was brave. She was brave to bring it to the entire family, to the therapist, and say this is wrong. She's very concerned about her little brother. Client has confirmed it. I think I already said that. And they both together want this to stop. They feel that some of this information could cause some problems with retaliation. They're worried because they've already told mom once before, and when mom approached stepdad, stepdad said okay, and then when she left, it got worse. So the kids don't want that to happen again. They also were hesitant to even talk about it. And so we've got this confidentiality and this very, very real situation for these kids. Not only that, we want to protect their safety. The therapist that is directing this whole treatment has decided to hotline this call and also get mom involved again. The client told me the last time I took him back after session, he said, "Mr. Jim, I just think it will get worse." And so we had to have a discussion about that. So there's lots of perceptions from these kids, worry and fear about what could happen to them. The good thing is that the client's strengths are huge. There's a lot of verbal maturity, not only from the young boy David, but Samantha as well. These kids have been worked with enough to where they can express their feelings, their emotions, and they can tell you exactly what this feels like. In fact, David, as we went out last week, he said, "Mr. Jim, this just shouldn't happen. This is not right." Also, these two clients have met many goals. They've worked on goals and objectives. They're focused. They're done. They get very busy and work hard in session. And so you've got a good track record, which is good. So we're happy about that. There has been in the past a good family support. Now I say good, even though I told you that there was very much a difficult situation with mom and stepdad, or mom and bio dad. Their communication stinks, and their follow-through is even worse. But the family does support the kids being in therapy. And so they make their appointments, they're on time, they come to session, and I think that's important. So what have I learned through this situation? Number one, family dynamics, family systems can be tricky and difficult. It's not easy to keep this many people going in session, up to date with all that's going on. I've also learned that family dynamics are also multifaceted. We don't want to accuse stepdad of being a tyrant or being ugly or being mean or being abusive. But we also have a duty to honor the clients and their safety and their well-being. I've learned also that I've got to refrain from making judgments. I've got to be cautious to make sure I get the full story from all parties involved and every player that's involved with the situation. And then mostly, I want to be true to my clients. I want to be able to trust them with their story. I want to be able to help them. I want to be able to empower them to be able to do the kind of therapy that they need to do, and to be able to work through this situation and to help the family system improve. So all things considered, very difficult situation, and yet I'm hopeful because of the team that we've got at YouthBridge that we'll be able to come up with a positive solution for both Samantha and David, but as well bio dad and stepmom and bio mom and stepdad. Hopefully I said that all right. Thanks.